She's a health navigator at Health Connections, Inc., and a Black AIDS Institute ambassador. So let's give a hand to welcome Elle.
And good morning. Yeah, hi, good morning. Oh my God, thank y'all. Thank y'all for service this morning. Good morning. I'm here to talk a little bit just about this coming Tuesday. August 27th is National Faith HIV and AIDS Awareness Day. And I love Val, I love the Zao community, I love Karen and Jonah, and lots of other people here, and I just want to, be able to share a community with y'all, and be able to just talk to y'all a little bit about HIV and our communities. Marginalized communities, and particularly people of color, are at high risk of HIV exposure in our lifetime. I often think that part of the repetitive messaging we as LGBTQ people receive about our risk and how high it is affects our mental health, self-worth, and bodily autonomy. A lot of our people don't protect themselves because they don't know how or think that they are fighting a losing battle, if all we ever hear is how at risk we are. But in church we know that our stories are written by God, that was stated earlier, and not by society or language about identity. We also know that He will show us the way out of the dark. HIV is preventable. This takes bodily autonomy, having partners that understand consent and making choices that won't put you at risk. This is hard. It's not easy, especially when so much in this world is out of our control. Our sexual health and bodily autonomy is something that we each deserve to be in control of. You deserve to be a leader in your relationships, someone that loves you when I make a decision about having sex or a sexual encounter, or the use of a prevention method without your consent. Right now I'm going to read a few statistics. Cis hetero people, straight people account for 24% of new HIV diagnoses, and 19% of that are cis het women. Women account for more than half of the number of people in the world living with HIV. Nearly half of the people living with HIV in the U.S. are ages 50 and older. Many of them were diagnosed with HIV in their younger years. However, thousands of older people get HIV every year. Older people are less likely than younger people to get tested, so they may not know that they have HIV. You can have HIV for years before it's been experiencing symptoms. Youth ages 13 to 24 make up 21% of all new HIV diagnoses in the United States. 81% of those diagnoses occurred among young gay and bisexual men, and young Black and African American men, and Latinx gay and bisexual men are disproportionately affected. A study of 28,000 transgender and non-binary people found that the rate of HIV infection among trans women was 3.4%, which is nearly 10 times the overall rate in the country. The rate was much higher among trans women of color. 1 in 5 African American trans women of color reported being HIV positive. Trans women, trans men, and non-binary people are all at high risk because of social determinants of health, and because trans women, men, and non-binary people also have high intersections with the world of sex work, and for trans men in particular, there has been an increase in new diagnoses. So that's just more of a reason to protect oneself. Among same gender-loving men, HIV testing and sexual health checkup frequency has been found to be low, less than 55% across the country. This means that many people are living with an undiagnosed STI, which may put them at even higher risk of HIV. Co-infections are real. We are all at risk of HIV because of stigma. Stigma, race, identity, and lifestyle choices are all a part of how people contract HIV. PrEP, pre-exposure prophylaxis, is a pill that blocks HIV after an exposure event. It is a deadly pill and prevention tool that is targeted towards LGBTQ people, but it should really be an option for everyone and an active discussion with all of our medical providers. PrEP is 99% effective and taken daily. Health Connections Inc. and Diverse and Resilient are two organizations I represent, and they are great testing and literacy care sites here in Milwaukee. When I read statistics, it infuriates me. We need radical change in prevention outreach. That means going into spaces that don't usually have the opportunity for sexual health conversations or conversations about HIV. That means in going to churches, to youth groups, collaborating with Latin and Latinx community organizations, knocking on doors, and more importantly, it means that we cannot stop until we end the epidemic. Our problem, our solution is a principle of the Black AIDS Institute. It's also one I've been able to identify and align with since I came out as a young gay man in high school in my previous identity. I feel that we as LGBTQ plus people have a duty to ourselves to end the epidemic for ourselves. And we have those tools: condom use, dental dams, PrEP, abstinence, pursuing sobriety and harm reduction or needle exchanges are all tools that we all should use. Lastly, we are all living in the legacy of HIV. We as the LGBTQ plus community have been affected, and many of us have lost families to HIV. While we are making advances, young men and all kinds of people around the country and around the world are still dying in marginalized communities, while the numbers in more privileged communities of people living full lifetimes is increasing. That's unacceptable. We need to uplift each other, and please get involved actively with the prevention community here in Milwaukee. Nothing is perfect, but I'm surrounded by passionate, dedicated prevention workers that want to do so much for our community, but they need support and for us to turn out for events, to support campaigns and initiatives. My mom is a minister. She's here with me today. I'm happy that she's here. Thank you. This is and she taught me two things about personal ministry. No life is a good life without community service. That was a very early lesson for me. And the second one is that she taught me that the message that God has in our lives will require unconventional ministry or leadership, and to never stop or to give up when you're doing something for the greater good. Thank God for this. Thank you.